I'm very happy to be here in Helsinki again. This is actually really new surroundings to me. I took a walk this morning and it's so beautiful, this part of Helsinki. Anyways, I've been asked to discuss clinical evidence in cow's milk allergy and synbiotics, and now I'm trying to figure out if I should look at my slides here or over here. I think I'll go for here. So here are my disclosures, and this is the outline of my talk. We will discuss a little bit about the importance of gut microbiota for immune system development, and I will share also my experience from the assigned study, the multicenter assigned study with symbiotics in cow's milk allergy management. And I would also like to touch upon a little bit symbiotics in this management. Where are we now and what are the next steps? So it is quite clear that a healthy gut microbiota is important for the development of the immune system. And this is actually reflected by the fact that the gut hosts around 70% of the human body's immune cells. And the gut microbiota will actually support the immune function and development. And as we heard in a previous talk, there is a constant crosstalk between the gut microbiota and the immune system. So if we take a little closer look at this figure, we can understand that the mucosal immune system is critical in the maintenance of immune homeostasis and also very, very important in suppressing overly reactive responses to harmless antigens and allergens. And imbalances in the gut microbiota, also known or termed dysbiosis, has been described to trigger immune disorders through the activity of T cells, and these include allergic reactions and also infections. There are a number of environmental exposures that will actually modulate and drive the development of the gut microbiota and the immune system in early life. This starts in pregnancy, continues in birth, and goes on into infancy. And what I would really like to highlight, and as Hanya also mentioned in her talk, this is actually a window of opportunity for microbiota modulation. So, breastfeeding is obviously the gold standard in infant nutrition, and breastfeeding will lead to an abundance of bifidobacteria, and this has been associated with appropriate development and functioning of the immune system, and also by improving the function of the mucosal barrier. And this can also provide resistance to infections by preventing colonization by pathogens or by pathogen overgrowth. So if we take a look at this table, we can see that human milk contains live bacteria, prebiotic, you could say, oligosaccharide, human milk oligosaccharides, and also lactose as the main carbohydrate. And so it's plentiful in many factors that actually stimulate the gut microbiota and also the immune system. Sometimes breastfeeding is not possible, and in the situation of management of cow's milk allergy, we have to bear in mind that the hypoallergenic formulas used are traditionally lacking these important factors, which leads to a limited or complete lack of stimulation of the gut microbiota and also the immune system. So, the symbiotic blend used in a number of RCTs is a combination of pre- and probiotics that was developed to try at least to mimic the levels and functionality and target gut microbiota dysbiosis. So the prebiotic used is very well studied. It has been studied in over 30 clinical studies in infants. And although not other expert organizations recommend prebiotics for allergic disease prevention, the World Allergy Organization actually took a bit of a different standpoint, and they acknowledge prebiotics for allergic disease prevention in formula-fed infants, not in breastfed infants, obviously. The probiotic, the bifidobacterial strain used here is the most common bifidobacteria species in human milks and in the gut of healthy breast infants. And it was actually selected for its ability to reduce allergic responses, as was shown in both preclinical and clinical studies. And it has a very, very long history of safe use. So this symbiotic was developed to try to target the gut microbiota dysbiosis. So if you look into this timeline, you can see that the research undertaken has been ongoing for over a decade. And this started with scientific insights and patient needs, followed by mechanistic experimental evidence and studies, and then first safety studies. That is of importance, of course, when you launch a new formula, that it's safety. This was then followed by studies with symbiotics for management of cow's milk allergy, and this is when I joined this journey as an investigator in the assigned study, which was a symbiotic study in the management of cow's milk allergy, and this was non-IG mediated cow's milk allergy, and then followed by a study of symbiotics in IG mediated cow's milk allergy. So if we take a look at the studies that have addressed safety, there are actually 4 RCTs that demonstrate that the hypoallergenic formula with this specific symbiotics are safe, they are well tolerated, and they also support normal growth. And if you have a look at the table, you can see that these studies were undertaken both in healthy infants and in infants with cow's milk allergy. So what about the assigned study then? Well, in this study, the objective was to investigate the effects of this AAF contained in the symbiotic blend, to look at the percentages of bifidobacteria and Eobacterium rectale and Clostridium coccoides group. And the latter was chosen as a bacterial biomarker of a more adult-like microbiota. And this was investigated in feces from infants with suspected non-IG mediated cow's milk allergy. So the design was a multi-center, double-blind, randomized controlled trial, and the intervention lasted for 8 weeks. So in this study, we included 71 infants with non-IG mediated cow's milk allergy, and importantly, we also had a healthy breastfed reference group, and they were aged from 0 to 13 months. And the product was AAF, or the same AAF with symbiotics. So you have to keep in mind here that in the assigned study, the primary outcome was the gut microbiota profile at 8 weeks. However, we also took the opportunity to collect a lot of data so that we would be able to explore secondary and exploratory outcomes. And these included clinical symptoms, stool characteristic, SAEs and AEs, medication use, growth, gut microbiota, also after the intervention, that is at 12 weeks and 26 weeks. So this is the study design, and you can see here in the upper part of the slide, 71 non-IgE cow's milk allergic infants. 35 were allocated to AAF plus symbiotics for 8 weeks, and 36 to the same AAF with no symbiotics. And the healthy breastfed reference group received no study product, obviously. And then we collected fecal samples at 8 weeks and at 12 weeks and 26 weeks. And at 8 weeks, there was an evaluation by the study doctor. And if it was found appropriate, the subjects would continue with the study product, but in some it was discontinued. So this is the primary outcome. And what we can see here is that there were increased levels of bifidobacteria in the group fed AAF plus symbiotics, depicted here in green. And if we compare the levels of bifidobacteria, we can see that they are closer to the levels in the healthy breastfed reference group. So what about the other bacterial biomarker then? Well, we could also see that there were lower levels of adult-like erectale C. cocoides group in the ones fed AAF with symbiotics. And again, you can see that the levels were closer to the healthy breastfed reference group. Interestingly, when we also analyzed the microbiota at week 12 and week 26, we can see that this effect was sustained, and there was a decrease of adult-like erectale C. cocoides throughout the follow-up period. We also took the opportunity to look at the microbiota a little bit more deeper by using 16S amplicon sequencing. And here we analyzed fecal samples at baseline, after 8 weeks intervention, and then at 12 and at 26 weeks respectively. And what we found here is that, we could see that there was enhancement of bifidobacteria, but also the fecal species diversity increased more gradually in AAF with symbiotics, again resembling the pattern seen in breastfed infants. And we also looked at the metabolic activity and also found differences in some short-chain fatty acids, again demonstrated a more infant-like microbial profile in those fed AAF with symbiotics. So that was the results from the ASSIGN study on microbiota, and actually there has now been 3 different RCTs that have looked at the gut microbiota in cow's milk allergy, and in both in non-IG mediated cow's milk allergy and in IG mediated cow's milk allergy, and the pattern is similar. We do see increases of bifidobacteria and also decreases of the ER to CC ratio, the more biomarker of a more adult-like microbiota. So what about the exploratory or secondary outcomes then? Well, we did see, this was not the objective of the ASSIGN study, but we did see that there was a trend towards more children in the symbiotic group that were able to tolerate cow's milk allergy after 26 weeks follow-up. We also looked at gastrointestinal symptoms, because this is sometimes a very worrisome feature in cow's milk allergy. And in this study, there were no differences between the 2 groups, but symptoms reduced towards the lowest possible score in both groups at the end of the intervention. What about the adverse events then? Well, we did see that there was actually a lower frequency of reported ear infections and use of antibiotics in the group receiving AAF with symbiotics. Again, this was not a primary outcome, but an exploratory outcome. And what about Other types of medication. Well, here the pattern was the same, that there was a lower use of dermatological medication in the group receiving AAF with symbiotics. You can see lower use of dermatologicals and also a lower use of emollients and protectives for treating skin. So we already heard Hanya talk about infections, and it is well known that children experience numerous simple infections, particularly in the first 3 years of life. And although they are not rarely fatal in our part of the world, however, they can have a considerable impact on childhood health, on hospitalization rates and quality of life. They also impose an economic burden to society because of healthcare use and parental work absenteeism, and secondary infections of parents and siblings. So this is an important issue to address. I showed the same, sort of same data that Hanya also mentioned. This is from the COPSAC study in Denmark, showing that there was actually a really high prevalence of infections in the first 3 years of life. 14 infections during the first 3 years of life. However, you see that there is also substantial variation in these otherwise healthy children. And you can also see that there is a peak of infections around age 1 year, and then with a slight decrease as the child grows older. And again, antibiotics are prescribed very, very often. Here in the COPSAC study, there was a higher use of antibiotics in ear infections and respiratory tract infections, and most frequently used drugs was amoxicillin followed by penicillin. And this is a potential problem. So Katie Sørensen and co-workers actually wanted to take a closer look at this, the potential role of symbiotics in infection. So they did a systematic review, and they found 7 publications, of which 4 were randomized controlled trials. They included infants with diagnosed cow's milk allergy, and they did a search according to PRISMA guidelines, and they completed this meta-analysis. So what I would like to do is to really highlight the key outcomes of this systematic review. Because they did find that AAF and AAF with specific symbiotics are equally effective in managing allergic symptoms and promoting normal growth. However, infants fed AAF with this specific symbiotics had significantly fewer infections, lower overall medication use, significantly fewer hospital admissions, compared to AAF, and this was quite compelling. And as mentioned, AAF with symbiotics was associated with increased bifidobacteria and reduced microbial diversity, again, similar to the healthy breastfed infants. So Sørensen and co-workers concluded that this review provides evidence that suggests that combining symbiotics with AAF produces clinical benefits with potential economic implications. In the interest of time, I will not go into this slide in detail. So, to summarize, of clinical studies with hypoallergenic formula with symbiotics. There is evidence that they are hypoallergenic, they are safe, well tolerated, they support normal growth in healthy infants and in infants with cow's milk allergy. They can impact the gut microbiota by bringing it closer to that of healthy breastfed infants with more bifidobacteria and less adult-like microbial biomarker composition. There are also exploratory and safety outcomes, and these show potential benefits with fewer infection, potential benefits with less gastrointestinal disorders, and also effects on skin, And not discussed today, there is one publication that has also reported a lower prevalence of asthma-like symptoms and asthma medication after 1 year of follow-up after these infants had been fed synbiotics. So, Hanya already mentioned the Esbjerg paper. I also recommend that you read it if you haven't. So, how far are we now from guidelines and position papers actively recommending symbiotics and hypoallergenic formulas for cow's milk allergy management? I think this is something that we will discuss during the panel discussion, but I will start to state my views here. So, I mean, it's undisputable that breastfeeding is the gold standard in infant nutrition, and it is also important to supplement infant formula with ingredients to bring them as close as possible to human milk. And there is evidence that AAF and DHF with these specific symbiotic blend are hypoallergenic, safe, well-tolerated, support normal growth, and modulate gut microbiota composition. However, what I think is lacking is actually more carefully conducted and well-designed clinical trials to actually determine the effect on tolerance development and infection-related outcomes as primary outcomes. Happy to discuss this further shortly. Thank you so much for your attention.